Calgary-South East.
Mr. Speaker, the members of this House will be familiar with the term shell game, where skilled hands working at a furious pace attempt to confuse the observer. And we all know that game and how it applies to the art of government budgeting. Now, Mr. Speaker, I'm sure the government is waiting for a zinger or a gotcha politics question. But in fact, Mr. Speaker, I believe in this case it's the government that's being deceived. To the Minister of Health, I'm speaking to you as a paramedic, embedded in that community with experience. You don't honestly believe that once you pay off an ambulance, that you can cut the EMS budget at the cost of that ambulance, do you? Please answer carefully, because paramedics are watching.
Honourable Minister.
Thank you, Mr. Speaker, and to the member for the question. It's clear that it is coming from a paramedic, not a Conservative, because the Conservatives, both parties, have pushed for billions of dollars of cuts, Mr. Speaker. So while we are working with AHS to make sure that they continue to protect and support the front lines, we've made it very clear that we want to see their budget held harmless, and we've done so by arranging a meeting I was happy to facilitate between the paramedics representation as well as with AHS, and that message was delivered very clearly, Mr. Speaker. So we're going to continue to support our frontline workers who every day work to support Albertans, Mr. Speaker.
First supplementary.
Mr. Speaker, given that the Health Sciences Association of Alberta president is also a paramedic, has denounced this budget cut, and given that EMS is already underfunded to the tune of $20 million necessary to make a greater contribution to the healthcare system here in Alberta, and given that this is over and above the $17 million that you and the Health Department are going to cut, to the same Minister, do you realize that in order for AHS EMS not to cut frontline services, you need to restore the $17 million? Will you do that?
Honourable Minister.
Mr. Speaker, thank you for the question from the member who does rightfully refer to the fact that the president of the HSAA is a paramedic, and the president with the HSAA sat down in a meeting with myself and the president of Alberta Health Services, and we articulated very clearly that we expect to maintain those frontline services, that it will be done with ensuring that we protect the frontline workers and making sure that they have the resources that they require. Mr. Speaker, we're waiting to see the AHS proposal for their budget, and when it is received, it will be posted publicly, and paramedics will be able to see that AHS is fulfilling their commitments that were made during that meeting, Mr. Speaker.
Second supplementary.
Thank you, Mr. Speaker. Given that you said time and time again that your government will invest in the most crucial of frontline services, given that there's a fentanyl crisis, a rise in post-traumatic stress syndrome, call volume on the rise, the seriousness of calls on the rise, increasing hospital waits that are killing the morale of paramedics, Minister, I implore you, revisit this cut to frontline services.
Honourable Minister.
Thank you very much, Mr. Speaker, and certainly I'm very proud of the work that our paramedics do each and every day. I was proud to visit a number of them just last weekend here in Edmonton, and I have to say that the work they do is crucially important to saving lives across Alberta. That's one of the reasons why we had this conversation, face-to-face opportunity to have discussions with Alberta Health Services, and they have also communicated with HSAA that they're going to make sure that they hold harmless the front lines. We're going to make sure that we protect them. And Mr. Speaker, I'm glad that the member opposite is standing up for paramedics. I hope that he will stand up for all Albertans, because his party certainly is pushing for a far drasticer reality than the one that he is arguing for, Mr. Speaker.
Thank you, Honourable Minister.